everybody. Our last segment here is talking about atypical stuttering, so cluttering, psychogenic stuttering, and neurogenic stuttering. The first couple are about cluttering. The first being, what exactly causes cluttering? Is it neurologically based like stuttering, or is the cause unknown?
I think the cause isn't exactly known for cluttering, but at this point, pretty much every speech and language disorder has been shown to have a very strong genetic component. I don't think cluttering would be any different. And I also see cluttering as kind of a mix between stuttering and language. And we all know that there are genetic and neurophysiological components to both of those. So I would suspect that there would be very similar underpinnings of cluttering as there is to stuttering.
When you're working with people who clutter, how do you monitor progress?
I think cluttering, like stuttering, is something that you don't just cure or eliminate. I think it's always with a person to a certain degree. I think progress in cluttering is based on a number of different factors. Number one is intelligibility, of how much of the person's speech that you can understand. I think there's a pragmatic side of cluttering where you need to measure progress as well and look at just social skill performance like topic maintenance, turn taking, eye contact, ability to have conversations and initiate new topics. And then I also think you have the language formulation aspect of cluttering, where you look at the language organization as something you need to measure progress in as well.
Absolutely. Shifting gears a little bit, what are the primary considerations when developing a therapy plan for a speaker with psychogenic stuttering? And I'm going to throw neurogenic stuttering in here as well.
Let's take psychogenic first. In order to develop a good treatment plan for somebody who has psychogenic stuttering, consultations and treatment with a psychologist has to be a necessary part of that plan. It's not like stuttering, childhood onset stuttering, where most of the counseling is probably related to speech and stuttering and should be done by a speech-language pathologist. With psychogenic stuttering, they stutter because of an underlying psychological condition. As such, you're already out of your scope of practice in terms of treating the underlying psychological condition, which has to be done by a psychologist. I think you have to look at helping the person, again, manage effectively by teaching them some strategies and techniques they can use to focus on the stuttering side while they're doing the counseling side.
Absolutely. And when we think about psychogenic stuttering, oftentimes therapy is very short-term. So being okay after 1, 2, or 3 sessions, if a client is demonstrating progress, being okay with discharge or dismissal at that point.
Neurogenic stuttering is a little bit different because a lot of times with neurogenic stuttering, a patient's outcome is dependent on recovery of the neurological system. Neurogenic stuttering is caused by some damage to the central nervous system, and so the extent to which the system recovers after the injury will largely dictate the person's performance. And again, you can work on strategies and techniques to help get the person through that a little bit easier and to make talking not as much work as it would be if you didn't work on those things. But you have to take into consideration the extent of the neurological damage as well.
I think one thing to keep in mind with psychogenic and neurogenic stuttering is that these populations are pretty uncommon that we would see and treat. We don't even have good prevalence or incidence data just because of, recovery, say, in psychogenic, or spontaneous recovery in something like neurogenic stuttering. So to be able to say how often am I going to work or see this type of population is really difficult to answer because it's fairly uncommon when we're working within the stuttering population. Greg, how many of these folks have you worked with in the past?
Psychogenic, I would say probably 3 to 4 in my life, and that's over almost 19 years now. And neurogenic, I would say the numbers are fairly similar to that.
Yeah, so again, a really small subset of the clients that we'll see and work with, but certainly a population that is important to be literate about. Okay, thanks everyone.